So I was going to follow seamlessly on from Stephen and perhaps talk a little bit from our sector's point of view about how we can play a key role in this emerging health and social care system. I want to do that through social prescribing, but I want to stress there will be lots of other ways of engaging, but I think I want to try and paint a picture in terms of the importance of social prescribing and how that can how social prescribing services can walk alongside people to improve their health and well-being, the impact that has on the system that Lucy's talked about, and therefore you can guess why it's so important that our sector is involved both in influencing and carrying out some of the delivery. So I came up with a grand title, God, that must have been late last night, Social Prescribing as a Part of an Integrated Health and Social Care System. That sounds grand. Anyway, you'll get the gist. And I'm still Ian Darch, as it says on the slide there. I'm going to move on to the next slide. So I asked a question about, you know, is it any different this time? You know, I'm very optimistic, and I have been pessimistic in the past. So I think now is a time of change. The Black Country and West Birmingham STP, or Healthy Future Partnership, have produced a document which talks about the future model of integrated care. And I pulled out one of a number of references to the voluntary sector, but their statement goes, our aim is bringing health and social care and voluntary sector organisations together to achieve improved health and well-being. That's music to my ears, and I guess if we stick to that, then, you know, my cynicism for the last 16 years will start to disintegrate. Thanks, James. So I wanted just to, lots of people will understand what social prescribing is, but I felt I should at the very least sort of summarise for those perhaps that don't. So there's lots of definitions. This is one from NHS England. Social prescribing link workers connect people with wider social needs to community groups and services. They're employed to give people time to focus on what matters to them. And based on what comes out of those conversations, introducing to community support, supporting them to take that up, breaking down barriers and so on. So often a link worker will spend quite a lot of time with a person. We worked out that the average is in total about 8 hours. So about a day is spent with each person, helping them to explore what they need, what they want, what interests they have, what barriers they face. So for it to work, we need two things. We need more than two, but two main things. We need committed, effective and caring link workers who have time to get to know customers, help them overcome the barriers they face, and understand what they want and help them to get there. It chimes very well with what Lucy was saying about, you know, working alongside people and understanding what their needs are rather than doing unto. And as important, if not even more important than that, we need a range of local social prescriptions that meet the needs of customers in the longer term. So social prescriptions could be anything really that helps people to engage, to develop, to create resilience. It's what our sector has been doing for many, many years, but it's now called something different. And if it works for us, well, why not, I guess. Thanks, James. So just a little bit about Wolverhampton Social Prescribing Service. We're really proud of this because we're one of the few areas in the country where there is one service across the city, and that is a really good example of excellent partnership working out and a really good start to this idea of an integrated care system. So Social Prescribing Wolverhampton, established as a pilot in 2017, was funded by the CCG. It was a one-year pilot. Very early on, we also secured money from the Department of Health, and the service was extended in 2018. In 2019, we agreed with all 6 primary care networks. So for those that don't know, in the city, GPs are split into PCNs, primary care networks. Every GP is in one of the 6 networks, and all of those networks are working with us. So we employ link workers. They're based in non-COVID times within those primary care networks. But in essence, we have one service for our city. There are link workers, as I say, based within PCNs, and then some that are based out in the wider community, funded through the CCG. There's one management information system, so there's no duplication of effort, and there's one process for referring people into the service. We're really keen that we don't duplicate or take over any of the work that organisations are currently delivering. That's not the idea. The service is designed to overcome people's barriers and then move them on into social prescriptions. So in that spirit, we have a subcontract with the CAB, and that's been running now for 3 years. We brought in Building Connections funding to develop a range of social prescriptions through what we call the Wellbeing Partnership. So we're working hard to bring money into the system and then sharing that with voluntary community sector organisations. More needs to be done, as I'll say in a minute. Prior to COVID, referrals were coming through at about 1,500 per year, so about 125 a month, something like that. And the target we were aiming at was about 150 a month. Thanks, James. So there's quite a lot of work going on about the impact of social prescribing. And remember, social prescribing is this interconnection between a linked worker and a social prescription. So it's the whole thing. What impact does that have? So I've picked out the evidence that is, I think, fairly strong and reliable. So the King's Fund said the evidence suggests that social prescribing has positive impacts on people's mental health, as well as reduced demand on health services, which is the other side of the coin when we talk about best use of money. British Red Cross said two things. They said 72% of customers reported reductions in feelings of loneliness 3 months after joining the service, as well as increased well-being and confidence. They also said that for each pound invested in social prescribing, there's a return in terms of savings elsewhere in the system of £3.42. So if we talk about the best use of our money, that's a bit of a no-brainer, I think. There is also evidence of reduced demand specifically. So University of Westminster carried out some research and identified there was a 28% reduction in demand for GPs and a 24% reduction in visits to A&E. That all takes time to filter through, and so this evidence is fairly new and a bit early. Locally, we can say we use two measures. We use the ONS Wellbeing measure, Office of National Statistics, and we used a measure of loneliness. It's called the Jean Gervelt, and I hadn't heard of it until I got involved in this work. But locally, 98% of customers reported some increase in well-being, and that ranged from sort of 5 to 10% right through to several 100% increase on the numbers, and 92% reported a reduction in loneliness as a result of being part of the social prescribing service. And we have also carried out a social return on investment evaluation, and that shows social return on investment just in excess of £4. So actually not a million miles away from the Red Cross. I think there is growing work in terms of developing the evidence that social prescribing, a bigger role for our voluntary sector in people's lives around health and social care, is proving really beneficial. Thanks, James. So I thought I should say something about COVID. I didn't think we could go 2 hours without mentioning it. Clearly, COVID is about the worst scenario for a service based on encouraging connection between people. You couldn't have anything worse, really. They stay apart. I think with the headlines coming into the city, quite understandably. So that's been a challenge. But actually, the need for connection during the COVID restrictions is even greater. And we would all have heard about increased isolation and loneliness. So what has the social prescribing service been doing? Well, we've kept in regular phone contact with many hundreds of customers. There are something like 700 that are sort of on the books, if you like, that we're in contact with. We have established a befriending service using volunteer befrienders. And very early on, we supported the Be Safe, Be Kind campaign run by the City Council. So anybody that rang that line, that helpline, and they were asked, did they feel worried and alone? And if the answer to that was yes, then they were referred through to social prescribing. We had something like 400 people that referred to us through that route. During COVID, we've worked with Access to Business to run a project called Support to Connect. So they've done the sort of that they've been supporting social prescribing customers who might have equipment but can't use it in the way that others perhaps can to keep in contact. So things like this, Zoom, I sort of become second nature when the technology works, but actually there were, and there still are, lots of people who are isolated, lonely. They might have a computer or a phone, but they wouldn't know how to use it to be able to develop these social interactions. That's gone really well. Over 100 people have been supported. We've also worked with James Clark and a couple of his colleagues who have been also supporting voluntary organisations to be able to run Zoom sessions and keep in touch with their customers. So we're trying to spread this across the city, and James and colleagues have been involved in other aspects of the project. As a result of that, we're now able to run a weekly programme of Zoom meetings. It's not really what we want to be doing. We would rather others were doing that, and this is very much a temporary measure, but the link workers have sort of stepped up and they're working with their customers on almost anything you can think of. There are fitness classes. We did some work with the university. There's online cooking. There's a book club. There's a men's cave, so on and so forth. There's sort of 15 or 16 groups now. And we have continued using all available social prescriptions that are out there. But, you know, unfortunately, as a result of COVID, as I'll say in a minute, our sector is, there are less social prescriptions out there than there were before. But I think we, like many other organisations, have continued to do the very best we can for our customers during COVID, and will as we hopefully emerge from it. Thanks, James. So as we emerge from COVID, I feel actually this wider approach, this whole system approach, and social prescribing and our sector as part of that is more important than ever. COVID's highlighted still further the impact of inequality regarding those wider determinants of health that Lucy talked about. Ability to resist the virus, to cope with lockdown, to bounce back and recover into, you know, feelings of well-being and health is not equal, nowhere near equal across our city. And we will all have heard about, you know, the inequality that has been exacerbated in some ways by COVID. A lack of social connections and networks is an important part of this. If people don't have the networks that they need to support them, then that in turn has a real downward impact on their well-being and their health. Social prescribing addresses or attempts to address this important inequality by considering mental, physical and social needs. So we look at the whole person and then refer them on to social prescriptions, ensuring that they have what they need around them. And, you know, having the right social connections, having the right links and contacts and support with the interests that you have has a real impact on mental as well as physical health. There was some interesting work done by Nottingham Trent University that showed people recover from operations far more quickly if they have social connection, if they have people around them that they talk to and that care about them. So the need for this is now even greater than ever, and a vibrant, effective and resourced community voluntary sector is absolutely crucial if we're to meet that growing need. It's now even more important than it was before the virus hit us. Move on, James. But, and there is a big but, our sector has faced years of austerity. Just within Wolverhampton, the amount of money available, for example, from the City Council, because of the cuts they're faced, has been reduced by something like 3/4 over the last 10 years. There is early evidence, and I hope this doesn't come to pass, but there's early evidence that shows that 10% of voluntary organisations will close as a result of COVID measures. So that's a national figure. Hopefully that won't be the case in Wolverhampton, but certainly it is happening. And there's no doubt that many voluntary organisations will struggle to return to previous levels of capacity and will need support to be able to do that. Commissioning and the distribution of funds legislates against small, locally embedded organisations that are crucial to social prescribing. There's still a tendency for large organizations, and I'm not against large organizations, it's just that it's really difficult for them to do that really personal local delivery that's really important to people's health and well-being. And big funding, big delivery partners, national organizations coming into Wolverhampton is not the best use of, in many cases, millions of pounds of resources. Those with direct access to public funding for health and social care, and I mean councils, I mean CCGs, I mean hospitals, need a strong local VCS to be able to deliver the vision that we've heard about and that's been written about by the STP, and should invest in those voluntary organisations. If not, then there's a real risk that we'll have, and I've used this phrase before, that we'll have the equivalent of travel agents, link workers, but no holidays. And that is something we absolutely need to avoid. With that warning, James, do you want to move on? I think I may be coming towards the end. Yep. So just to try and pull all that together, as I started on doing this presentation, I thought, God, what have you taken on here? You're going to try and describe social prescribing, what it does, and link it into the system. But I sort of think it works. So our sector and social prescribing as part of that is an important part of this new integrated system that we're talking about. So there's no doubt in my mind that the health and social care system needs to change. Individual staff and organizations do absolutely brilliant work. I was in a hospital actually over Christmas, and actually that sounds dramatic. I came out of hospital on Christmas Eve. I wasn't in on Christmas Day, but the service that I received there, and I've done like hospitals, I was a bit worried, was absolutely brilliant, and COVID was pretty widespread in that hospital. So this isn't a criticism of any organizations or individuals, but there is a disjointed system, and I think that lets them down and it lets us down. We need to work better together, use our funding better, use our people better. COVID illustrates again how inequality in the wider determinants of health and wellbeing damage people, and contributes to the huge pressure on acute services that I heard about 16 years ago, that we were going to try and ease the pressure on them. Our sector supports people to keep well, supports self-care, works alongside people as guests in their lives. And I find that's a really useful way of looking at things, as guests in people's lives, working alongside them to improve those lives. Through linking people who are isolated, lonely, and facing anxiety and depression, or with long-term conditions, linking them with local organisations and groups, social prescribing does help to get people where they need to be in order to keep well. So to reduce that length of time that people are spent alive but unwell with conditions, depression, anxiety, and so on. So it's in everyone's interest to ensure those groups and organisations that make up our sector are resourced and thrive. And I am encouraged by the words that are being spoken within the STP, who will have access to many, many millions of pounds and have to make decisions about how they use that money. What I'd say to summarise is that the aspirations of a future model of integrated care will only be utilised fully if we work together to bring about that strong voluntary and community sector that I've talked about.